Today in this video, I'll be doing my head to toe assessment on a patient. So first I will sanitize my hand or wash my hand. I will put on my gloves. Then I'm going to clean my stethoscope using alcohol wipes. Then I'm going to go introduce myself to my patient. So my name is Melissa. I am a student nurse at Seneca College. And today I'll be doing a physical assessment on you. Is that okay?
Yes.
So could I confirm your name and date of birth, please?
Tyson Menard, December 12th, 2007.
Okay, so Tyson, could I touch you?
Yes.
Okay, so I'm going to pull the drips for privacy. So Tyson, are you comfortable?
Yes.
Do you need to empty your bladder before we begin the procedure?
No.
Okay, so according to Tyson's physical appearance and data collection, Tyson is 13 years old, male with brown skin. He is tall, which at least 6 feet, with a slim build. His body structure is symmetrical. He has no obvious physical deformities. Looking at his behavior, Tyson's facial expression is happy. His speech is not slurred. He has good personal hygiene, and he has good eye contact with me. So Tyson, do you use any assistant devices to walk around?
No.
Okay, so Tyson does not use any assistant devices to walk around. He's able to move around and do his activities of daily living independently. So could you breathe in and out for me? Take a deep breath and out. So Tyson shows normal breathing sounds. He has no signs of distress. Could you sit for me? Now I'll check his level of consciousness. So Tyson, do you know where you are?
At home.
To tell me today's date.
December 2nd.
Do you know who's the Prime Minister of Canada?
Justin Trudeau.
Okay, so my patient is awake, he's alert, and is oriented ×3. Next, I will inspect and palpate his head. So on inspection of his head, the head is round and is aligned with his spine. I will palpate the head now. Do you have any pain?
No.
Okay, on palpation, my patient has no pain, lesions, lumps, or swelling. Now I'll inspect and palpate the hair. So on inspection of the hair is black in color. I'm going to palpate it now. He has no lice or infestations. His hair is full and evenly distributed. Now I'll palpate the patient's facial expression. On inspection of the face, it is round and in brown in color. On palpation, the facial temperature is warm in touch. Do you have any pain?
No.
Patient has no scars, lesions, edema, or swelling. Now let's test cranial nerve number 7, which is the facial nerve. So could you smile for me, Tyson? Okay. Could I see your teeth? Okay. So could you frown? Could you lift your eyebrows? Lift your eyebrows. Could you shut your eyes tightly? Okay. Could you puff your cheeks out for me? Okay. So Tyson did all that with ease, and therefore facial nerve is intact. Now I will move to his eyes. I'll be inspecting his lashes, his eyelids, his eyebrows, his sclera and conjunctiva. So Tyson's lashes are black. His eyelids are evenly distributed. So on inspecting further, Tyson's sclera is white. His conjunctiva is pink. There is no discharge. Now I will test cranial nerve number 3, which is the oculomotor nerve. I'll be using the pen light, and I will have you keep your head straight, and you're just gonna follow the pen light with by moving your eyes, okay? Don't move your head. Now could you stare at the object on the wall? I'm gonna use a pen light to shine a light on the side of your head, of your eyes, sorry, and to see if your pupils will constrict, okay? Stay straight. Now we will test for accommodation. Could you just stare at the object, and I'm going to move your head side to side for me. Okay. I'll move the pen light towards your nose. So just look forward. I'll move the pen towards your nose, okay? Don't move your eyes, don't move your head. So Tyson's pupils are equal, they are round, they are reactive to light and accommodation. Now let's assess cranial nerve number 2, which is the optic nerve. I will show you a chart and ask you to read some letters for me, okay? The last line.
Five, 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 five.
Okay, so patient optic nerve is intact. So let's assess the ears. On inspection of the ears is round in color and brown. There is no discharge and there is no lesions. Now we palpate the tragus, which is at the front of the ears. Then we palpate the auricle area at the back of your ears. Do you have any pain?
No.
Okay, so my patient has no pain and tenderness on palpation. Now we'll be doing the whisper test. I will cover one side of your ears and I will say 3 words and you're going to tell me what you said, okay? I said. With your head straight.
I love you. I love you.
Okay, so patients heard and repeated what I said. Now we will proceed to do the otoscopic examination. We're going to use the otoscope. So we're going to inspect the tympanic membrane. So on examination, the external is brown in color with no discharge or foreign bodies. I'm going to pull the air up and back because he's an adult. The tympanic membrane is green color with no bulging. Now let's assess cranial nerve number 8, the vestibulocochlear nerve. I'm going to cover your ears on one side and I'm going to tell you 2 words and you let me know what you heard, okay? Keep your head straight for me.
My mother.
Okay, so the patient heard what I said, so his vestibulocochlear nerve is intact. Now, let's assess the nose. So an assessment of the nose, inspection of the nose, it is midline in his face. There is no discharge coming out of his nose. There is no flaring. On palpation, do you have any pain? So my patient has no pain on palpation. Now we are going to assess cranial nerve number 1, which is the olfactory nerve. Close your eyes for me. I'm going to put something under your nose and you tell me what it is, okay? Keep your eyes closed. Okay. So patient told me what it was and therefore cranial nerve number 1 is intact. Now we will assess the mouth and the pharynx. So on inspection of his thing, I'm going to use a tongue depressor. His lips is pink in color. There is no swelling. There is no lesions. Could I see your gums? So my patient's gums are pink. There is no swelling, bleeding, lesions. His teeth are white. Open your mouth. So he has no loose teeth and no cavities. Now we're going to use our tongue depressor. Keep your mouth open. On inspecting the tongue, open your mouth, put your tongue out. The tongue is moist. It is pink. No atrophy. Open wider for me. So the soft and half palate is pink, no lesions, and they are intact. Now let's assess cranial nerve number 9, which is the glossopharyngeal nerve, and cranial nerve number 10. So, keep your head straight, Tyson. So, open your mouth, right? So, lift up your tongue. Lift your tongue. The glossopharyngeal nerve is white and nice and pink. Could you say ah for me? Patient's soft and soft palate rises when he says ah. So the cranial nerves, close your mouth. Cranial nerves 9 and 10 are intact because the patient is able to talk with no hoarseness. He is also able to swallow. Let's assess further the glossal nerve. Could you put your tongue out for me? The tongue is midline. Could you move your tongue side to side? Say light, tight, dynamite. Okay. So the hypoglossal nerve is intact. The patient has no tremors. Now we're going to assess the patient's neck. Stand up for me, you're too low. We're going to inspect and palpate the neck. So on inspection, lift the neck. The neck color is brown. There are no scars. The skin is warm to touch on palpation. There are no obvious enlargement of the thyroid. Do you have any pain?
No.
Okay. Now let's assess the patient's carotid arteries on both sides. So the patient's carotid arteries is 2+ and equal, and it's strong. Now let's assess the spinal accessory. Could you rotate your head for me? Up and down and around. Okay, good. Now I'm going to put my hand on your shoulders and you shrug it back for me, okay? Against resistance. So the spinal accessory is intact. Now we are going to move to the upper extremities. So we're going to look at his upper extremities. So I'm looking at upper extremities. It's brown in color. There are no lesions. There is no scars. There is no sign of involuntary movement. No deformity or swelling. So on palpation, it's warm to touch. There are no masses, no joint temperature. Do you have any pain?
No.
Okay. So patient reports no pain. I'm going to check the skin tugger. So his skin tugger is normal. Let's look at your nails. So his nails are white in color. Capillary refill is less than 2 seconds, and there are no lesions. Now let's test active range of movements of the upper extremities. Could you move your fingers for me? Back and forth. Okay. Could you move your wrist towards your body and away from your body? Could you move your elbows all around? Your elbows. Let's your elbows here. Could you bring your shoulders back and forth for me? Okay. I'm going to put my hand on your shoulders and you shrug against resistance for me. Okay. Did you have any pain while I was doing these exercises?
No.
Okay. You can sit down. Patient reports no pain. So now I'm going to palpate the radial pulses. Give me a hand. Give me the other hand. So the radial pulses are 2+ and equal with a regular rate and rhythm. Could you grab onto my hand for me? We're going to test your hand grip and squeeze me as tight as possible. The other one. So patient's grip is strong bilaterally in both hands. Now let's assess the lower extremities. Would you lie down for me? In terms of color of his lower extremities, it is brown in color. There are no lesions, masses, come closer now, and no involuntary movement or deformities. On palpation, the skin is warm to touch. There is no edema, swelling, no masses. Do you have any pain?
No.
Okay. Patient has no pain or joint inflammation. Let's palpate the dorsalis pedis. I'm going to go from the middle of the toe down. The pulse is 2+ and equal and strong. Now let's palpate the tibial pulse at the back of the foot. The pulse is 2+ and equal and strong. Now I'm going to test the dorsiflexion. You're going to put your toes up for me. Next one. Okay, now we're going to do the plantar flexion. Your feet toes down, one at a time. Okay, so dorsiflexion and plantar flexion, they are equal bilaterally in both foot. Okay, so next, they are equal bilaterally. Next, we're going to assess the thorax, lungs, and cardiovascular. Could you turn over for me, please? It has to be in the back, the posterior. So on inspection, the skin color is brown. There are no scars, no lesions, no skeletal deformities. The anterior ratio is 2:1, which is normal. Now let's palpate the anterior thorax. On palpation, there are no masses, lesions. It's warm to touch. Do you have any pain when I did that?
No.
Okay. So patient reported he had no pain. Then let's palpate for tactile phrenitis and symmetrical expansion. So you're going to say 99 for me every time I tell you, okay?
99, 99, 99, 99.
And for symmetry, could you take a deep breath for me? In and out. Another one. Okay. So now we will auscultate the broncholovascular and vascular breath sounds. So his breath sounds are normal. The vascular is stronger than the bronchovascular. We're going to check for wheezing and crackles now. So the patient has no crackles or wheezing. Now we'll auscultate the valves. Could you turn around for me, T? And lift your shirt. Up, way up. So first we're going to do the mitral valve. It is located at the 5th intercostal space in the mid-clavicular line. Then we're going to go to the tricuspid valve. That is located at the 4th intercostal space at the left sternal edge. Then we're going to go to the pulmonary valve. It is located at the 2nd intercostal space at the sternal edge. Then we're going to go to the aortic valve, which is located at the 2nd intercostal space on the right side, on the right sternal edge. Then we're going to continue auscultating for S1 and S2 sounds. So S1 is louder than S2 at the apex, and S1 is softer than S2 at the base of the heart. Now we continue auscultation for extra breath sounds, S3 and S4, and also heart murmurs. Now we'll assess his abdomen. First, I will ensure that he's covered, he's appropriate, so he has his pants on. So firstly, I am going to look at his abdomen to inspect. So the abdomen is brown in color, it is round. His umbilicus is midline. There is no masses or scars. Now auscultate for bowel sounds. I will start on the right lower quadrant. So the patient has normal bowel sounds in all 4 quadrants. Now auscultate for burette sounds. Then I will percuss the abdomen in all 4 quadrants. I'll start with the right side, lower right quadrant. Okay. Now I'll palpate. I'll do light palpation on the 4 quadrants. Tell me if you have any pain, okay? You have any pain?
No.
So my patient records no pain in all 4 quadrants of his and no superficial masses or no rigidity. Now I will perform Murphy's sign. I'm going to press on you and you're going to take a deep breath for me, okay? Ready? Take a deep breath. Do you have any pain?
No.
Okay, let's do the Bloomberg sign. You had any pain?
No.
Okay. So now we're going to assess for sensation. I'm going to use a cotton ball. Where's my cotton ball? You can put on your shirt. Turn your hand like this. With the other hand, a bit far from me. Do my feet as well. Now we're going to assess your biceps. I'll be using the reflex hammer. So could you stretch out your elbows for me? Inside of your elbows, like this. The other one. And the triceps. Move it a bit. The other one. You're going to go down to your knees. Then we're going to check the Achilles, the back of your foot. Then we're going to check the Babinski reflex. Past the edge of the arm under your foot. Sensation. Now you assess the neuromuscular function. Could you stand up for me? So could you stand up on the tip of your toes? Could you walk on your heels? Okay, and could you stand straight for me? Put your foot together, close your eyes, and just stand for at least 20 seconds. Okay. All right. So this concludes my head to toe assessment. I hope you enjoyed my video. Thank you. Stop now.